8 hours or 8 days into the flu or something?
10 days.
10 days in.
Yes.
You got the Tamiflu and all that stuff.
Yeah, no, I'm not contagious anymore.
Yeah,
I still feel
good.
like I got hit by a truck, but it's okay.
So it's literally at the forefront of our vocabulary and our brains is the flu, and now for the first time it's crept into the vocabulary of, well, your pets, your animals, your dogs, AJ.
Yeah, I'm more worried about my pets than I am about me. Forget me! Is my dog okay?
Dr. Fick is here. He's a local veterinarian. What is the veterinary office that you work at, Dr. Fick?
We're at Grand Blanc Veterinary Hospital on South Saginaw Road.
All right, that's where we take all of our animals, all of our wacky schnauzers and cats.
Yeah, I think
and
you did a procedure on our dog recently.
Yeah,
A little bumpy on her back. Got rid of that.
Yeah, always happy to help.
Well, thank you much for coming in early today, and let's talk.
You guys, you have like you guys do surgeries like super early, so.
Yes, I'll have to get there soon to start, surgicating on the pets there. So I'm happy to be here. Yes.
Well, let's talk about this dog flu because, like we've been saying, the flu, influenza, has been, everyone's talking about it. It's an epidemic in our country with people. But now for the first time, AJ started reading about and seeing that can also slip into your dogs, into your animals. And
yeah, they were like, don't worry about the people flu, worry about dog flu. I'm like, oh my gosh, I can't keep it straight.
So should people be worried about the dog flu?
It is more of a concern nowadays. It first entered this country about 2003 to 2005 in the greyhound racing population down in Florida, I believe. But it's been slowly making its way, across most of the states, almost 40 states now.
Okay.
And we've not had any major outbreaks in this area of Michigan.
That's good.
But Toledo has had some outbreaks, and so vaccination is becoming more and more prevalent nowadays.
Which, I mean, that's, Toledo's close enough for us. And so vaccination. Now, what are some, I guess I should ask, how does a dog even get a flu? Is it like the same thing as the human flu, or is it like a dog flu?
It's very similar. It's a totally...
It would be a dog flu, Pat.
Right.
It's not a people flu. It's a dog flu.
Yeah, very species-specific. Can't be transmitted back and forth between people and dogs, but they get it a lot of ways the same way we do. Sneezing, coughing, close contact. Also, just touching surfaces that have been infected with the virus itself.
Okay.
Oh, really? Yeah, I was just watching a thing. I was watching Bill Nye. I was watching Bill Nye, the Science Guy. And it was...
Were you doing that with our son or just on your own time?
No, it was... but it was about, the spread of bacteria and germs.
Oh,
and
yeah.
obviously, it's so much more than you think in your mind. But, so it's the same way that animals pick up stuff like that.
That is correct. And so we see a lot of the transmission when there's close group housing, usually kennels and doggy daycares and groomers, that sort of thing.
Okay.
And so, just anytime they're grouped together close, they can, touch nose to nose, or a sneeze can travel, 6 feet or more and infect a dog across the room even.
That is true. So right now, should people be, you think, more concerned or less concerned or the same concerned about sending their dog to like a doggy daycare? Because that's a big thing now. A lot of people send their animals off to go somewhere every day.
Well, I think it's important to remember that just because an animal gets sick at like a doggy daycare or like a grooming place, it doesn't necessarily mean that place is dirty per se. You know what I mean?
Correct.
It can just happen.
Yes. We go to the movie theater, you can get infected with the flu from just being close to someone there.
Exactly.
But around this part of Genesee County, we don't worry as much about canine influenza. I was talking to a industry representative, pharmaceutical representative yesterday, and according to her, Novi and south of Novi kennels are requiring the vaccine.
Okay.
Around here, it's still optional. Not every clinic offers it as of yet, but it's something that more and more of us are looking into. We worry about kennel cough. A lot of people have heard of that.
Yeah.
Yes.
That just refers to a whole wide variety of viruses and bacterial infections they can pick up. But pretty soon, we will have to be more concerned about influenza most everywhere.
Okay, so here we are. So if your animal, if you think your animal may be sick, what are some of the symptoms, and what do you do then?
Good question. A lot of it is, the similar symptoms as kennel cough: coughing, hacking, sneezing, lethargy, no energy, fever, loss of appetite.
Yeah.
And if there's any concern, contact your local veterinarian right away.
There you go.
And try and keep your canine companion in your car until we can get you into an isolated room, because just walking into a clinic can easily spread, those
the waiting
viruses.
room, yeah.
Boy, that's
absolutely
true. Just like when you go to to an urgent care, they're saying take on the mask. I didn't even think about that. You get all those animals together.
Yeah, so it's something we try to avoid, further transmission by, keeping suspected patients isolated from other patients there for other reasons, and we can try and make a diagnosis based on symptoms. There are ways to test for it, but it can be either costly or time-consuming. It doesn't change the treatment plan. We treat it as any other virus. There's no cure for viruses.
Sure.
You just have to keep them healthy in other ways. Antibiotics, keep them hydrated, keep them fed, that sort of thing.
Well, once again, the same way that you are watching over your child and your spouse, like I am with AJ, trying to make sure she's okay.
I don't care about me. Now I'm watching the pets. Don't get sick.
Look out for your animals as well. Dr. Fick is here. Dr. Fick, thank you so much for waking up early and coming in with us. You are a vet down at the Grand Blanc Veterinary Hospital. And by the way, how hard is it to become a vet? It's hard, right?
It's challenging, but it's very worthwhile. It's been a great adventure, and happy to be here.
I'll tell you.
Your dad was going to go to school to be a vet and stopped because it was too hard and became an eye doctor.
Yeah, he's like, I'm going to go be an optometrist. This is, you guys are nuts. All right, well, thank you so much, Dr. Fick.
Thank you, Dr. Fick.
Of the Grand Blanc Veterinary Hospital for coming in this morning. And look out over those animals, right? All right, everyone. It's Cars 108.